The world continues to be ravaged and challenged by the coronavirus pandemic. As of the 27th of January 2021, the global total cumulative confirmed cases of coronavirus is 100,216,000, and sadly, an estimated 2,155,000 have lost their lives. Whilst some countries have succeeded in containing the virus, others see the fire blazing with renewed fervour. One of these countries is Malaysia. You are all by now familiar with these types of charts. This captures the daily incidences of confirmed cases of coronavirus in Malaysia. The time span is from the first recorded case on the 25th of January 2020 to the 22nd of January 2021. It is important to distinguish between confirmed cases and actual cases. The daily numbers of actual cases of coronavirus in Malaysia and everywhere else will always be higher than what is reported. This is owing to two reasons. First, most countries do not have the capacity to test everyone. Second, as we are all well aware by now, many carriers of the virus are not tested. Many have either mild symptoms or are asymptomatic, which means that whilst they are infected and contagious, they personally observe few symptoms that warrant a visit to the health clinic. Glancing at this chart, it appears that during the first half of 2020, Malaysia had the virus generally under control, albeit with a few spikes. However, the last weeks of September saw a significant jump in cases. This period is referred to as Malaysia's third wave. This dramatic upward trend has continued unabated, reaching a peak of 5,725 cases, the nation's highest daily incidence on the 29th of January 2021. To have a better understanding of Malaysia's coronavirus landscape, we will start at the beginning. It was in the first early days of 2020 that the world began to take notice of the worrying situation in Wuhan, China, and the distinct possibility of contagion across the world. The World Health Organization declared coronavirus a global pandemic on the 11th of March 2020. The numbers of cases in Malaysia during this early period were mostly 0 and single digits, then later in the low double digits. This was Malaysia's first wave. From mid-March, the situation began to change. On the 15th of March, 190 cases were recorded, the first triple-digit daily caseload. This represents Malaysia's second wave. A religious mass gathering was attributed as a significant factor for this sudden increase. The wider availability of test kits and increased testing also plays a part. Malaysia responded rapidly and resolutely to the growing pandemic. The government introduced a national lockdown on the 18th of March, termed the Movement Control Order, commonly referred to as the MCO. The capital city of Kuala Lumpur became a ghost town. Here are two pictures to compare visually the impact the lockdown had. On the left is Masjid Jamek subway station. On the right is the popular tourist shopping area in Chinatown. This is what they looked like during the lockdown. Cases of coronavirus continued in the triple digits, reaching a peak of 235 on the 26th of March. Cases began a shaky but certain trend downwards, reaching double digits in the second half of April. The national lockdown continued until the first week of May, where the Prime Minister announced a conditional MCO, designed to be a phased, gradual reopening of the economy and the country overall. Different states implemented the conditional MCO on differing dates. we can see several spikes in cases from the 25th of May to the 4th of June. Initially, there were fears a lockdown was ended prematurely, and that the movement of people during the religious holiday of Eid was the underlying driver. However, Malaysia's health minister explained the spikes were owing to isolated clusters in detention centres. So far, it appears Malaysia had successfully contained the virus. With cases in the low double digits, Malaysia entered a new confident phase. The conditional MCO was revised to the recovery MCO on the 10th of June. There was a palpable sense the worst was behind Malaysia. Significantly, interstate travel was permitted. Malaysians could now visit relatives and go on much-needed vacations. In September, the recovery MCO was extended and daily cases remained in the low double digits, even occasionally dipping to single digits. It is in the faraway Bornean state of Sabah where Malaysia's third wave begins. The state election on the 26th of September and the prior 2 weeks of election campaigning exacerbated an already growing caseload originating in a prison cluster named the Benteng LD cluster. The state of Sabah soon represented the majority of all new daily cases from mid-September to the first week of November. Sabah became Malaysia's new epicenter, and Malaysia's third wave begins. It was precisely on the 22nd of September when Malaysia witnessed its last double-digit case. From the 23rd of September onwards, confirmed cases of coronavirus reached triple digits. This would rapidly increase to the high hundreds by late October, and soon after, daily cases in the thousands. This third wave continues today. The recovery MCO was upgraded to the theoretically stricter conditional MCO on the 14th of October, specifically for Kuala Lumpur and Selangor as a preemptive strategy to prevent the situation in Sabah spilling over into the nation's economic and administrative heart. However, with the virus spreading uncontrollably across Malaysia, by around the last week of November, Sabah's contribution to daily infections was overshadowed by other states. Daily new infections were rapidly rising across Malaysia, in particular Selangor and its neighbour Kuala Lumpur. A key driver for Selangor's growing caseload was owing to clusters. People returning from Sabah drove one set of clusters. Other clusters were linked to shopping malls, housing complexes, offices, and industrial centres, the largest of which was a cluster linked to Top Glove, the world's biggest rubber glove manufacturer. From the last double-digit daily case on the 22nd of September, Malaysia witnessed an incredible growth in new daily cases. The end of the year was marked by two grim numbers. On the 24th of December, total cumulative cases topped 100,000. And on the 26th of December, a new daily record of 2,335 was recorded. The new year did not bring an end to this trend. Instead, ever higher daily cases were witnessed. On the 7th of January, the 3,000 mark was broken. Later, on the 16th of January, 4,029 new daily cases were recorded. More recently, an even higher number of 5,725 cases was recorded on the 29th of January. The government, seeking to flatten the threatening upward epidemiological curve, declared a second lockdown on the 13th of January for several states, including Selangor and the capital Kuala Lumpur. Soon after, all of Malaysia was declared under lockdown, except the state of Sarawak, which was faring better. The national lockdown, termed MCO 2.0, is less stringent than its predecessor, which can be interpreted as an attempt at balancing the needs of the economy with that of public health in the context of preventing a catastrophic failure of the health system. Furthermore, the government declared a national emergency on the 12th of January. This allows the government to use all available resources, including private hospitals. On a final note, Malaysia's second lockdown is scheduled to expire on the 4th of February. Whether the lockdown will decrease new cases is unknown. Whether the lockdown will be extended or perhaps made stricter is equally unknown.